Good morning, everybody. Let me first introduce myself. I'm Federica Buccino, a PhD candidate at the Mechanical Engineering Department of Politecnico di Milano, and today I'm glad to present you the work entitled Isolating Lacunar Morphology to study the influence of bone-lacunar network in damage progression. The research, developed together with Professor Sara Bagherifard, Marta Ghidini, Professor Carlo Alberto Biffi and Professor Laura Maria Vergani, is a joint collaboration between Politecnico di Milano and CNR, Consiglio Nazionale delle Ricerche, in Lecco, Italy. With this research, we are in the context of bone fractures that are often caused by pathologies such as widespread degenerative illnesses, osteopenia, osteoarthritis, or may happen in presence of rare bone diseases such as osteopetrosis. More in depth, age-related bone fractures represent an increasing health and economic concern. Projections of age-related fractures in the United States show an increase of 50% in 20 years, starting from a value of 2.1 million in 2005. This evident increment is strongly related to the increase in the average age of population. Indeed, with the aging process, human bone becomes more brittle and more prone to fracture. The number of women exceeding a fracture threshold is 6 times higher than for men. Often, when fractures extend to the vertebral bodies or to the hip, patients cannot be treated in a day hospital but need to be bedridden, involving medical and nursing staff for assistance. This raises not only an enormous health concern but also an economic burden for the disease management. The health problem is also connected with the concept of frailty, defined as an increased vulnerability due to long-term hospitalization for fracture treatment, impaired quality of life, and disability. As regards economic aspects, a projection of worldwide direct and indirect expenses related to the identification and treatment of hip osteoporotic fractures is expected to rise almost to $100 billion in 60 years. An overview of the economic impact of fracture treatment and fracture prevention in different countries is presented in this slide. For this reason, a deep comprehension of how bone fractures start and propagate is a key aspect to be deepened. However, it is particularly difficult to predict bone fractures and to define different levels for bone fragility. In fact, there are several parameters that play a role when considering bone fractures. First, bone is characterized by a complex hierarchical structure. The macroscale is the whole bone level, while the mesoscale is represented by cortical and trabecular structures. Both cortical and trabecular bone are constituted by micrometric lamellae, composed of preferentially oriented collagen fibrils. Inside the fibrils, there are lacunae, submicrometric cavities, where osteocytes reside. This intricate architecture is reflected in fracture patterns. Indeed, damage occurs at different scales. While at the macro scale the identification of those fragility fractures is assured by the clinical practice, microscale features are still underexplored. Their investigation could lead to a more accurate and early diagnosis of several bone pathologies. In this research, a special interest is devoted to cellular level porosity, represented by the lacunar network, a complex system of cavities populated by osteocytes, whose role is still under debate. Lacunae play a dual mechanical role, influencing both strength and toughness. In the first instance, lacunae are stress concentrators, contributing to strength reduction. However, considering bone as a damage-tolerant material, lacunae give a beneficial contribution to toughness by deviating the crack path. In this context, several pathologies seem to have a specific effect on the lacunar network by varying its three-dimensional arrangement and local lacunar parameters such as size or shape. So the aim of this research is to investigate how a variation in the lacunar distribution or in the lacunar shape in presence of several pathologies, as an example osteopenia, osteoarthritis, or osteopetrosis, could affect bone resistance to fracture. In order to isolate the effect of lacunar morphology on damage progression, healthy bone lacunae are replicated in samples made of titanium alloy, more in-depth titanium 6 aluminum 4 vanadium, realized by means of laser powder bed fusion in CNR, Consiglio Nazionale delle Ricerche, Lecco, Italy. An additional notch is introduced to simulate external surface discontinuities, typical of natural bone samples. The titanium specimens are then analyzed by means of the micro-CT in order to test the reproducibility of the lacunar disposition and geometry. Mechanical tests are performed including static tensile tests with a cross-head speed of 1.60 mm per minute and fatigue tests performed with a frequency of 20 Hz and a stress ratio of 0.1. Tensile tests are performed instead of compressive tests due to the presence of unmolten titanium powders inside the lacunae caused by the intrinsic property of the laser powder bed fusion fabrication method. Both fatigue tests up to failure and interrupted cyclic tests are performed in order to identify the region where the crack starts and how it propagates. Fracture surfaces are observed by stereomicroscope and by scanning electron microscopy. In parallel, both static and fatigue numerical simulations are implemented. Fatigue simulations consider the possibility to investigate both the fatigue life of the component and fracture analysis. Once the models based on healthy bones lacunar network are validated, different configurations are explored in order to consider the effects of different lacunar morphological features encountered in osteoarthritis, osteopenia, and osteopetrosis. The healthy lacunar network configuration serves as a preliminary validation for the implemented computational models. Three different categories of samples are selected: 3 specimens without lacuna, 3 with 1 lacuna, 3 with 6 lacunae, and 3 notch samples with 6 lacunae. The results for tensile tests show a decrease in elongation at break and a more brittle behavior for samples with a higher number of lacunae. Fatigue tests show a clear effect of the lacunar voids in sample life and in damage propagation. The visualization of the fracture specimens show that in absence of an external notch, the crack starts from lacunae, while in presence of the notch, crack starts from it and encounters lacunae, as its path is influenced by lacunar arrangement. Sample toughness and crack patterns are significantly influenced by the presence of different lacunar networks. The starting point of the crack could be predicted by numerical models validated by means of microcomputed tomography analysis. Variations in size, shape, density, and alignment of the lacunar network are considered for the analysis. Small size and elongated lacunar samples show slower crack propagation. The same trend is visible in presence of lacunar network characterized by a lower density and alignment with respect to the direction of the applied load. The main limitations of the experimental study reside in the difficulty to reproduce lacunae as empty cavities due to remaining unfused titanium powders inside lacunae. Additionally, high computational effort is needed to perform extended finite element analysis. Despite from these drawbacks, the chosen approach presents several potentialities by allowing to investigate toughening mechanism and to extend the results to other pathologies. Further developments may focus on considering the effect of bone-like canals and vessels to evaluate damage progression. In addition to this, all the findings could be useful in order to design novel bone-inspired structures. In conclusion, I would deeply like to thank you all for your attention and to thank once again all the collaborators that made this research possible. Sara Bagherifat, Marta Ghidini, Carlo Alberto Biffi, and Laura Maria Vergani. Thank you again.